Hi guys, this is Dr. Shamima Sutharuna from the YouTube channel Doctor to Help. Today is June 27, 21, and we are going to talk about Chloasma. First, thank you for joining me in today's video. For those who don't know me, I'm an internal medicine doctor, board certified, practicing in Texas. Alright, let's talk about Chloasma or Melasma. Are they the same thing? Is there any difference? Not really, they're both the same. But melasma is usually referred to the mask of pregnancy. That means it is the hyperpigmentation of the skin that occurs during pregnancy and usually goes away after the delivery of the child. Can take a few weeks to months to go away, but in very rare condition, it can pop up years after delivery. I am sorry about that. Okay? All right, so what causes it? You know that we have melanocytes in our skin, right? So the UV rays from the sun can stimulate these melanocytes to produce melanin. Overproduction of this melanin can cause this condition, all right? Unfortunately, women have it more commonly than men. 1 out of 5 person in men will have the chloasma, and mostly it happens in darker complexion and more in sun exposed areas, so in more hot climate areas, unfortunately. Is there anything you can do to prevent? Yes, you can. So we are going to talk about diagnosis, cause, prevention, and treatment of chloasma today. All right, so we know about the UV rays. It causes the overstimulation of the melanocytes that's causing the melanin, right? And where does it deposit? It usually deposits on our cheekbones, nose bridge, upper lips, and our forehead. It can also happen to any other parts of our body exposed to sun. So what we can do automatically, you know it, we want to prevent sunburn. So we want to reduce our exposure to UV sun rays, UVA and UVB. So sunblock is very important. You want to use SPF 30 plus. The minimum 30, the higher the better, right? So, and how often do you want to use it? Every 2 to 3 hours. Remember, it gets worn off when you're using it, especially if you're swimming in the water. So you want to frequently use it several times a day when you're out in the sunlight. You want to avoid sun rays between 10 a.m. to 2 p.m. That's the highest concentration of UV rays in a day. So you want to, if you still have to go out, wear sunbream, wide brimmed hats, protective clothing, so you are not so much exposed to the sunlight. You want to wear sunglasses, wide plastic sunglasses, not metal. If you have metal frames on your sunglasses, they reflect the sunlight and can cause more damage rather than good. So you want to wear sunglasses that are wraparound and plastic in their boundaries, or what can I say, in their content, all right? Not metal. Also, do you think the lights inside our home can be dangerous for our skin? Unfortunately, yes. The light from the headlamp, from our devices are also harmful to us. So we should also wear some sunblock at home every morning. All right? So these are the things that we want to keep an eye on. So as far as, is there any genetic predisposition for chloasma? Unfortunately, yes. If your mom or your aunt had it, there's a good chance you may have it too. Is there something you can do to prevent it? You don't have it yet, you're only 20, you're young, 20 and 30s. Can you do something to prevent? Absolutely. You can use retinol. What is retinol? It's a vitamin A derivative. Yes, you can get it over the counter. But careful. 2 places where you cannot use retinol. Can you guess? Yes, pregnancy and breastfeeding. When you are pregnant or you're breastfeeding, you should not take any kind of retinol, all right? Every other places you can, and retinol is really good for you. But another caution, if you're new to retinol, please do not use it more often than once in every 3rd day, all right? Why? It causes inflammation of your skin. What retinol does is rejuvenating new cell production. So there will be some inflammation, there will be some flaking of skin. So if you use it too often, you can have hyperreaction, and that can be very, very, very harmful to you. So if you're just starting out, you want to use it every third day. After a few weeks, go to every second day. After another few weeks, go to every day. So make sure your body can tolerate it. Also, the skin around your eyes is very sensitive. It's the thinnest part of your face. So you can have more damage in those areas. So to prevent that, you can also use a moisturizer. All right, you can use a moisturizer, then put on the retinol, and then on top of it, you can use another moisturizer. And then that would be a retinol sandwich. That will not be so damaging. So do these things first before you go and be more adventurous. Is there anything else you can do other than retinol? Yes. For those, where can you get retinol before I move on? Retinol, you can get it over the counter. Think about CeraVe, the resurfacing retinol renewal serum. You can use those. And like I said, third day, then second day, and then you can finally, on several weeks later, you can do it every day. All right? So if you already have Chloasma or Melasma and you want to get rid of it, what can you do? Melasma, I would leave it alone. All right? After pregnancy is over, it will hopefully just go away. All right? So it's just a short time, right? But if you're not pregnant, you can use hydroquinone. You can use about 4% hydroquinone. You can also use azelaic acid, kojic acid, or arbutin. All right? Those are the things you can also use on your skin for treatment. How often should you use it? Use it about twice a day. All right? Use it about twice a day. And the retinol, you probably use it every third day and gradually go to every day. All right? That retinol is for prevention. Hydroquinone is for treatment. And you can also get hydroquinone over the counter, but for higher concentration, you need to see a doctor and get a prescription. All right? So, what else do you want to know? Retinol. What are the benefits of retinol? Before we move on and finish this video, I want to also let you know that retinol is very good for our skin. It helps with anti-aging. It prevents hyperpigmentation. We already talked about it, right? It also decreases the pores on our face and makes our texture more smooth. All right? So, and we also know that it rejuvenates new cell production. So, retinol is very good for us. I'm going to show a few pictures of the different types of retinol that is available over the counter that you can buy. And also, if hydroquinone and all those did not work for you, you can also do micro needle application on your face, and you can also do laser therapy. Now, laser therapy, you may need second session first and maybe a repeat session, and it can be pretty expensive. It can be up to $2,000. All right, so you can also look at Groupon. Sometimes they give good discounts, and maybe that would be something you might consider. All right, for those people who don't have so much money, guess what? What else can we use? Have you ever heard of turmeric powder? Yes, the active ingredient is curcumin. If you use that with milk, 1:2, milk and turmeric powder, 1:2 mixture, and you apply on your face, you can also help with your hyperpigmentation. All right, you can reduce it. So that would be something else. And guess what? Turmeric powder is also anti-aging, antioxidant, antibacterial, and anti-carcinogenic. So a lot of good benefits from turmeric powder as well. So there's thousands of publications on the benefits of turmeric powder. Please go and do some research and you will find out. All right, so that is all for today. Thank you again for joining me. If you like this video, please don't forget to like and subscribe. Send it to your friends, whoever you think will be helpful for them. And this video was done in request of multiple people. I'm glad you encouraged me to do it. I was so excited to learn new things. And actually, I'm going to apply it on myself for especially the retinol. All right? And again, thank you for joining me. I'll see you next time. Take care. Bye-bye.